Hello and welcome to my YouTube channel, Dr. Winnie the Pharmacist, where I discuss all things health. If you are just seeing this pretty face for the first time, my name is Dr. Winnie. I'm a board certified pharmacist and a practicing herbalist. Today I'll be discussing the consequences of excess vitamin A intake and the health implications. So before I delve into the consequences of excess vitamin A intake and the health implications, I'd like for us to talk a little bit about vitamin A. Let's look at vitamin A and what vitamin A does and what it really is. Then we'll branch into the consequences of taking excess vitamin A. Vitamin A is a fat-soluble vitamin and an essential nutrient. Another name for vitamin A is retinol. So you'll hear me using the word retinol a lot in the course of this video. Retinol is actually the scientific name for vitamin A. Now, the term vitamin A includes or encompasses or covers a group of chemically related compounds, namely retinol, retinal, retinoic acid, and a group of provitamins, for example, the beta-carotenoids. So before I continue, I'd love you to know that there are two groups of vitamins, namely the fat-soluble vitamins and the water-soluble vitamins. Now, there's a short trick I used to use when I was in school. I'd like to teach you that trick so that you can use it to distinguish between what is fat-soluble vitamin and what is water-soluble vitamin. So when I want to talk about or remember the fat-soluble vitamins, I just say ADEK, A-D-E-K, ADEK, ADEK. For those who are Yoruba, Ade, then you put K, ADEK. Now, ADEK simply means vitamin A, D, E, K. These are the 4 fat-soluble vitamins. So if you remember the word ADEK, you remember vitamin A, D, E, K. Those are the fat-soluble vitamins. Then any other one that remains are water-soluble, which are basically 2. Vitamin B and vitamin C. Like I said earlier, vitamin A is a fat-soluble vitamin naturally present in many foods. It is important for normal vision, the normal functioning of the immune system, reproduction, growth, and development. Now, in order for this video not to be too long, I normally, when I say something that I feel is too bogus, or maybe people who are not medically inclined may not understand, I normally explain the meanings. But today, to make this video shorter, I'll be explaining most of the meanings on the screen. If I say something that I feel is too bogus, I'll put out the meaning on the screen, please. So if you are lost somewhere or you do not understand, just look at your screen or rewind in order for this video to make sense, or the information I'm passing out here to make sense. Thank you. Vitamin A also helps the heart, the lungs, and other organs to function properly. Now let's look at the foods that are rich in vitamin A. Number 1, you have leafy green vegetables such as kale, spinach, broccoli. Secondly, we have the yellow-colored or orange-colored vegetables like carrots, sweet potatoes, pumpkin, and so on. Tomatoes, red bell pepper, cantaloupe, mangoes, beef liver, fish oils, milk, eggs, juices, fruits and dairy products, many breakfast cereals, and fortified foods. Actually, we have vitamin A in many breakfast cereals because they're actually fortified. When I say fortified here, I mean that vitamin A has been included into the cereals while producing it in the industry. Later on in the course of this video, I'll still talk about sources of vitamin A, but this time around I'm going to break it into plant source or plant-based vitamin A and animal source or animal-based vitamin A, and I have a reason for doing this, and I'll explain to you. So what's the recommended daily allowance or RDA of vitamin A? When I say recommended daily allowance, this is the limits, the maximum limits that one needs per day, after which when one exceeds, then problems may begin to set in. So what is the recommended daily allowance for vitamin A? Now, we have RDA for men and we have RDA for women. For men, the RDA for vitamin A is 900 microgram RAE. That's 900 mcg, which stands for microgram RAE. RAE here stands for retinol activity equivalence, which is approximately 3000 IU. IU here means international units, while that of women, that's the recommended daily allowance for women, is 700 microgram RAE. That's 700 microgram retinol activity equivalent, which is equivalent also to 2333 IU. Now, I'm sorry for bugging those who are not medically inclined with quite some grammar this evening. However, I would like you to know that we usually measure vitamins in IU, that's international units, though lately I learned that the FDA has started enforcing it, that the quantity of vitamins in drug or supplements or even in food should be stated in micrograms. So from all I've just said lately, it's just common sense and common logic. From the word recommended daily allowance, this simply means that this is the dose that is recommended daily. So if you stay within these limits, one will not have problem. But if one goes above this recommended daily allowance, then problems can set in. So do you see why it is important to know the RDA so that you don't exceed it and then cause problems? From what I have said, in case one doesn't want to talk about the RDA or the recommended daily allowance in micrograms, one can talk about it in terms of international units. The RDA of vitamin A in men is about 3000 IU if I'm talking about it in IU, or 900 microgram. You see how I'm stressing it so that people will know. Then for that of women, it's 700 microgram or 2333 IU. I would also love you to know that the maximum daily intake of vitamin A, which is unlikely to cause harmful effects to health, is 3000 microgram of preformed vitamin A or 10,000 IU. Now that we have known a little bit about vitamin A and then the RDA, let's look at when is vitamin A excess or toxic or poisonous. When will one say that vitamin A is excess, toxic, or poisonous? Vitamin A becomes excess when adults take several hundred thousands of IU of vitamin A. At this rate, the vitamin A becomes toxic and poisonous to the system. Chronic vitamin A poisoning may occur over time in adults who regularly take more than 25,000 IU of vitamin A per day, or a single large dose of over 200,000 IU. Let's look at the signs and symptoms of vitamin A poisoning or vitamin A toxicity. Signs of vitamin A poisoning includes drowsiness, irritability, vertigo, nausea and vomiting, abdominal pain, headache, rashes, seizures, bone thinning, bone fracture, bone pain, sensitivity to bright light, for example, sunlight, peeling of the skin, peeling of the palms, and peeling of the sole of the feet, cracking of the corners of the mouth and yellowing of the skin, blurry vision due to elevated, that's when it's going up, intracranial pressure. So if you see these signs or notice these signs in a human being or even oneself, then they may likely be signs of vitamin A toxicity. It's not necessarily that it must be vitamin A toxicity, but like I've already mentioned, these are the signs of vitamin A toxicity. So if you notice these symptoms, it may be, so you look out for it and you watch out for it. If you suspect, then you take necessary action. Early symptoms of vitamin A toxicity include dry eyes, cracked lips, allergic contact dermatitis, psoriasis. Sorry, like I said earlier, look at the meanings up there. I'm putting out the meanings up there at the same time. Alopecia for both the hair and the eyebrows. Alopecia simply means loss of hair. Increased risk of infection due to dry nose, dry lips, dry mouth, and dry mucous membrane. Dry, rough skin, and reduced sebum production. We've looked at the signs of vitamin A toxicity. We have also looked at the symptoms. These are the things that somebody will come up with. Then it will now be safe to conclude, after doing more tests and diagnosis, that one has vitamin A toxicity. We shall now look at the long-term effects of vitamin A toxicity. The long-term effects of vitamin A toxicity include 1. Bone thinning or bone fracture. When I say bone thinning, I mean loss of bone mass. From the word itself, thinning, when something begins to get thin, so the bone begins to lose itself. There's, like, you see my hand, but the bone, this bone becomes thinner, so there's a loss of bone mass. And of course, when there's a loss of bone mass, if the bone is thinner, it will become more fragile. It's easy to break. So sometimes you can now see that it's not every bone breakage or bone thinning or loss of bone mass, especially soft fragile bone, that is due to lack of calcium or lack of vitamin D. It could actually be as a result of excess vitamin A, and excess vitamin A is usually acquired from taking supplements, not from the natural source, but from taking supplements. So those who take excess supplements here and there, take this, take that, take that. It's good to have money, it's good to use supplements, but it's very good to be cautious. Really, many supplements are actually over-the-counter drugs, but I'd advise you, in my own opinion, as a qualified and registered pharmacist, that before taking supplements, you should consult your healthcare provider so that you receive the best advice in order to avoid problems like toxicity and other issues like this. More long-term effects of vitamin A toxicity include serious joint and bone pain. Now, there's a lot of occurrence of arthritis these days. A lot of people are complaining seriously about arthritis. So I'd love you to check what kind of supplements are you on, because if one is on vitamin A supplements or supplements that include vitamin A, and he's taking the vitamin A in excess, you can see that toxicity will set in. And if toxicity sets in, then you have serious bone pain and serious joint pain. And most times when the person goes to the doctor, when patients or people go to the doctor, they make this error of not telling the doctor everything that they are taking. Maybe they feel that the supplements are doing them good, so they don't even talk about it. But you can now see that one may be having joint pain and bone pain as a result of excess vitamin A. So most times what happens is that the doctor or the healthcare provider tends to start treating otherwise. Maybe they'll begin to suspect arthritis or other things because they don't know that the patient that they're talking to is on supplements or vitamin A supplements or supplements that contain vitamin A, and maybe it is now excess. So you see, these are the possible reasons why sometimes treatments don't work. Because let's say, for instance, let me use myself as an example. Let's say if I am taking excess vitamin A supplements and then I go to my healthcare provider and I complain about bone pain and serious joint pain, and my healthcare provider gives me a pain reliever, maybe a strong pain reliever to relieve the joint pain and the bone pain or to relieve the arthritis. Meanwhile, I'm still taking the vitamin A supplements or the supplements that contain vitamin A, and it has already accumulated in my body and it's already excess. It will not work. These are the reasons for drug failures. It won't work. Still on long-term effects of vitamin A toxicity. Another long-term effect of vitamin A toxicity is diarrhea. So you can now see that it's not all diarrhea that is as a result of infection. Some are related to the supplements we take, like excess vitamin A, which I'm talking about this evening. Headache due to nervous system changes. So some people persistently have headache even after taking Tylenol or Panadol or paracetamol. The headache is recurring. So you should know yourself, check out, look at whether you are taking some things in excess. Still on long-term effects of vitamin A toxicity, you have nausea and of course most likely vomiting due to nervous system changes. We also have birth defects, bone loss. I've talked a lot about that previously. Now, birth defects, it's really a very bad one, because I know that none of us would like to carry a baby in the womb for 9 months only to come and give birth to a deformed child. And the birth defects could range from, there are quite a number of birth defects that could arise as a result of vitamin A toxicity, ranging from hydrocephalus to microencephaly. I'll be explaining that in another video. Even heart problems and lots more. I'll do thorough explanation about the possible birth defects that can arise from vitamin A toxicity in another video, so that this video will not be too long and it will be understandable. Increased risk of hip fracture. I guess you know why there will be increased risk of hip fracture, because from my previous explanation I said that excess vitamin A can lead to bone loss, that is loss of bone mass, and pain. The hip bones too, they are bones, so they get more fragile and then they easily break or fracture. In order to avoid this kind of things, one should keep his or her vitamin A intake within the recommended daily allowance, or RDA.
Next, we have interactions with the beneficial actions of vitamin D. Yes, excess vitamin A could actually interact with the way, or interfere, better put, with the way vitamin D works. So it does not allow vitamin D to work properly. And you know that vitamin D has a lot of benefits too and functions. Also, we have ectropion, which affects the skin around the eyes. And other long-term effects of vitamin A toxicity include high cholesterol levels. Now, we all know what excess cholesterol can do in the body. I'd love you to know that there are two types of cholesterol: the bad cholesterol and the good cholesterol. The bad one is called HDL, that's high density lipoproteins, while the bad one is called LDL, low density lipoprotein. Other long-term effects of vitamin A toxicity include skin irritation and liver damage. I did a video earlier on about how excess vitamin A causes liver damage, so I'd love you to go and watch that video in order to get acquainted and informed about how this vitamin A in excess causes liver damage.
Just a quick and brief one. I'd love you to also know that fat-soluble vitamins are stored in the liver. So when you have excess in the body, they are usually stored in the liver. And the liver does not just store them as per just for 1 day or 2 days. The liver can store them for years, at least over a year. Even long after probably you are no more on excess vitamin A, or you're no longer on vitamin A, the liver stores them because they are fat-soluble vitamins. So the fat-soluble vitamins are very easy to become toxic to humans. What I mean by this is that it's very easy for someone to develop toxicity to fat-soluble vitamins as compared with that of water-soluble vitamins, because all fat-soluble vitamins are stored in the liver. And you know that the liver is an organ which excretes wastes from the body. So when it has excess of these vitamins already accumulated, it causes toxicity. Caution: for pregnant women or women who want to get pregnant, or who want to take in, or who are preparing to take in, please always seek the advice of your doctor or healthcare professional before taking any vitamin A supplements. Do you know that people who are taking a variety of supplements are actually getting much more vitamin A than they should? Yes, it's possible. People will take a variety of supplements, several supplements. A good example here is cod liver oil. Some people may be taking cod liver oil for vitamin D, but may not be aware that it is also high in vitamin A. Having said that, please, if you use cod liver oil, ensure that your other supplements do not contain extra vitamin A. Always ask a qualified healthcare provider before embarking on taking supplements. Other forms of fish oils do not contain significant amounts of vitamin A, but always check the labels. I'd like you to know that there are claims that vitamin A in the form of retinol or retinyl palmitate added to some sunscreens, moisturizers, and lip balms can cause vitamin A toxicity. However, there are no evidences yet. But retinoids in skin creams can cause the skin to become highly sensitive to bright light. First, it is advised to apply vitamin A creams at night and to avoid strong sun after their use. Another possible cause of vitamin A toxicity is the use of retinol-based medications. A good example of such retinol-based medications is isotretinoin, spelled ISOTRENOIN, and the trade name of that drug, or the brand name of that drug, is Accutane. Doctors usually prescribe that drug for severe acne. Anyone using this drug, that's the Accutane that I just mentioned, should avoid using vitamin A supplements, because this drug is a vitamin A derivative. A doctor will not prescribe isotretinoin or Accutane if a person is pregnant or will become pregnant. Very important notes: there are two main forms of vitamin A in the human diet, namely, 1, preformed vitamin A, that is retinol and retinyl esters. So in other words, I'm saying that retinol and retinyl esters are preformed vitamin A, and these come from animal products, fortified foods, and vitamin A supplements. The second form of vitamin A is the provitamin A carotenoids. Example of these include alpha carotene and beta carotene, which are converted to retinol, and they are found naturally in plant sources or plant foods. There are other types of carotenoids which are found in food and are not converted to vitamin A but have health promoting properties. These include lycopene, lutein, and zeaxanthin. Someone asked how much vitamin A is toxic to the liver. Well, the answer is very simple. More than 40,000 IU, which is equivalent to 12,000 microgram per day, is toxic. Now, I'd like you to know that provitamin A carotenoids are not usable forms of vitamin A. They exist naturally, but the body converts them to usable forms of vitamin A. The both forms of vitamin A that I mentioned earlier go through additional breakdown in the body to become retinal and retinoic acid. Very important notes: generally, if you follow a diet rich in beta carotene, you do not need supplements. This is because supplements can lead to undesirable excesses in beta carotene levels. These cannot occur if your vitamin A source is from what you eat. So from what I'm teaching you in this video, vitamin A supplements are more beneficial to those who do not get enough of it from food or diet. It's just simple English and common logic. The word supplement. Supplement means to add something to complement or to enhance it. So what are you enhancing? If you eat well, you have a balanced diet, eat vitamin A rich foods, then what are you supplementing? This is akin to maybe a very pretty lady who has put on makeup, maybe light makeup, or doesn't even need makeup at all to look nice, and then feels that, oh, okay, I need to enhance my God-given beauty, and then she now adds the lipstick, puts it up to here like a masquerade, rubs the eyeshadow and the, what they call it, all these paintings, overpaints her face. At the end of the day, she will now look like a masquerade. That is how it is when we take supplements that we don't need. You are simply not enhancing anything. You are enhancing problems, diseases In fact, you are enhancing death. You are calling death quickly. Now, I'd love to release a very important secret to you. Plant sources of vitamin A are the best and the safest sources of vitamin A. And because of this, I have already earlier on in this video highlighted the sources of vitamin A, but at that time I mixed everything up. So for the sake of what the information I just passed now about plant sources of vitamin A, I am going to separate the plant sources from, that's the example of plant sources, from the animal sources of vitamin A. I am not saying by this that animal sources of vitamin A are not good. They are all good, but plant sources are the best and the safest. So right now we are going to list plant sources of vitamin A separately and animal sources separately so that you will know. Plant sources of vitamin A include Chinese cabbage, carrots, spinach, kale, asparagus, chives, apricots, squash, many margarines, ketchup, raw red sweet pepper, mangoes, herbs and spices like chili powder, oregano, paprika, parsley, and so on. So you can see that there are so many sources or plant sources of vitamin A. So I should not hear you say that you're lacking vitamin A or you're going around looking for supplements when you've not exhausted the food or plant sources of vitamin A. So far so good. I've mentioned not less than 22 plant sources of vitamin A. That's a lot. So now let's look at the animal sources of vitamin A, which include beef liver, fish liver, dairy products like milk, then human breast milk too for babies, hard-boiled eggs, cheese, meat, fish, and poultry. I'm talking about egg yolks here when I'm mentioning poultry. Butter is also an animal source of vitamin A, and so on. So with these few points of mine, I've been able to highlight the many plant sources of vitamin A and the animal sources of vitamin A. To wrap up this video, I'd like to touch some highlights. Fat-soluble vitamins pose a greater risk of toxicity than water-soluble vitamins when consumed in excess. This is because they are stored in the body, and the part of the body where they are stored is the liver for longer periods. In fact, vitamin A can be stored in the liver, or fat-soluble vitamins, like I said, can be stored in the liver years after one has stopped taking vitamin A or the fat-soluble vitamins. I also mentioned that vitamin A toxicity can be due to either topical or oral administration. When I say topical, I mean anything you rub on the skin or you administer by rubbing on the skin, like the creams. We call it topical. And then when I say oral administration, I mean taking something through the mouth, like the drugs, the supplements. Finally, how can we get rid of excess vitamin A in the body? Simple. By 1, stopping supplements, or in rare cases, stopping foods that contain vitamin A. Also, to flush out excess vitamins from your system, ensure that you always drink plenty of water. This will encourage urination, allowing the body to shed off the excess vitamin A. Finally, always consult your healthcare provider before taking supplements, no matter what. So this brings us to the end of this video. I'd like to encourage you to please subscribe to this channel for more informative and educative videos about health improvements and health education. I'd also like you to share these videos as much as possible so that people who are not informed can become informed. For it is said that knowledge is power, and so that we can enlighten the world and make the world a better place. I'd also encourage you to hit that notification button so that you'll always know when I make new videos. Also, make your comments, observations in the comment section and ask questions that you would like me to answer, or maybe suggest videos that you would like me to make, like topics that you would like me to talk about. I'd also finally encourage you to give my videos a lot of thumbs up and likes. Thanks for watching. Goodbye and God bless you.